Hello learners, I'm Dr. Veenu Agarwal. I'm a pediatrician and today we shall be discussing about acute diarrhea. Diarrhea means a patient is suffering from loose motions or maybe vomiting. Our objectives after this lecture will be that we should be capable enough to understand the various causes of diarrhea and how severe is the dehydration because of the diarrhea and how to manage such a child who is suffering from diarrhea. I shall be trying to discuss the clinical presentation in the form of cases. So this is the case 1. He is Sonu, a boy who is 9 months old and his weight is 8 kgs. He came to us with the complaint of loose motions and vomiting. He had vomiting today only, but loose stools were present for last 2 days. Beside these two complaints, the mother feels that he is crying too much and he is passing less urine. When we inquire how is he being fed, then she shares that baby is on diluted cow milk which is being given by bottle. When we ask about his vaccination, she says he has been given only the vaccines which are supposed to be given at birth only. Then what should we say he is suffering from? The answer will be he is suffering from acute gastroenteritis and he has some dehydration also. The treatment part I shall be discussing later again, but here I would like you to understand how the simple prescription of a such patient would look like. So the first and the foremost important thing is to take care of his vomitings so that he can take and he can hold his medicines which we are giving him to treat him. So first we give him 1 dose of an antiemetic. Then according to Indian Academy of Pediatrics, all the children below the age of 5 years should be given zinc and that too for 14 days. The other thing is oral rehydration solution. We tell them patient how much to give, how to give. We guide the mother to keep on watching how many stools he has passed. Has he passed urine? Is he vomiting again and again now also? Whether his abdomen is soft? Is he more comfortable, less irritable now? Then we tell her what to be given to the baby. If we find on history that something wrong is being given or some wrong ways used to give him feeds, we counsel the mother. The aim of explaining and mentioning all these things is that we understand that writing antibiotics, antiemetics only will not be complete. We have to see, is his diet okay? Is his feeding okay? Is his vaccination okay? I shall be discussing all these issues later again. Now let us move to the another slide. Another slide is another case. So she is Paki. She is younger than the previous baby. She is only 8 months. She is a girl and she is thinner also. She is 6 kgs. And we can read on the slide that her loose motions are for 15 to 16 days. The earlier Monu was ill only for 2 days. But Paki is not well for last 14-15 days. So one thing is very clear. This is not simple diarrhea. This is called persistent diarrhea. It means if stools, loose stools persist beyond 14 days, it becomes a more serious issue. Beside the persistence of diarrhea, mother tells me that she has noticed slight amount of blood also in today's morning stool. So this means this girl is having dysentery as well. And definitely you can see she is 6 kgs, so she looks thinner than Monu. And mother says she is given milk by bottle and she is not drinking it okay. She says although she is very thirsty and she drinks water eagerly, but she is not happy to drink the milk. When I examine her oral cavity, I see there is some whitish deposit on her cheek and her tongue. So this girl, definitely she has dehydration. This girl has undernutrition and she is more thicker than the serious than the previous baby. Now let us see the picture of Paki. The slide on the left, you can see her eyes looks like they are sunken in. And when On the right side, I pinch her skin, so there is loss of skin elasticity and her skin remain like a tent after I have removed my fingers. The picture on the extreme right shows that her anterior fontanelle, this is a diamond shaped space. It is made between frontal bone in front and parietal bones in the back, and this becomes depressed. We call it sunken fontanelles. The other symptoms suggestive of diarrhea are thirsty, less amount of urine. She looks lethargic. If we see the picture on the left side, she is looking not interested in her surroundings. She is closing her eyes partially closed and she looks sick. So now I want you to read carefully and slowly with me. We have to understand how will we come to know that any baby who is suffering from diarrhea, is passing loose stools or is having vomitings, he has become dehydrated as well. So one very important point in the history will be his urine output will be less. So I have to specifically ask mother, Mrs. Sonia, will you please tell me how much urine Pankhi is passing? Mother says she is passing 2-3 times. Then I will ask Mrs. Sonia, was she passing urine more often than she is passing today? This is on the history. Then I ask, do you feel she is more thirsty? A mother will be able to say, yes ma'am, she is more thirsty and she is very irritable. Then the signs which we have discussed earlier, we have seen in the picture also, we can see here also. Now, one very important point we have to decide, where will we like to treat the child? I will be showing one more child, and you have met Monu, you have met Pankhi, and now we will be meeting Tanya. So she is Tanya. You can clearly look on her face. She does not seem to be conscious. Tanya is 18 months. She was having loose motion for 3 days. But since last night, she has vomited 5 times and she is very sleepy. And mother is very worried because she says Tanya has not passed urine since last 12 hours. So one very important diagnosis that she is suffering from diarrhea, that is acute gastroenteritis. Gastro we are saying because she is having vomiting, enteritis we are saying because she is having loose motion. And what do you feel? Is she dehydrated? The answer is yes ma'am, she is definitely dehydrated. Although we have not touched her, but she is so lethargic. And more important, she has not passed urine for last 12 hours. So definitely Tanya is suffering from acute gastroenteritis with severe dehydration. So the very important question which I wanted to ask is, where will you treat Monu or Pankhi? And will you like to treat Tanya at home? So of the 3 kids, Tanya should not be at home because she is not conscious. I cannot ask mother to give her oral syrup to control her vomitings because if she is not fully conscious, she may take this medicine into her trachea and she may aspirate. And maybe I would not like to wait ORS to take care of her dehydration. Maybe I would like to correct his dehydration fast by giving IV fluids. And also because I cannot rely on the capability of the mother to know and decide if she is improving by ORS or not. And I may like to get some blood tests done on her also. So this is the reason for all these things to be done. She has to be with us in the hospital and she needs to be admitted. So now to start our lecture in traditional way, is an MBBS graduate should know about diarrhea? The answer is yes, because it is the most common disease of gastrointestinal tract. The another important reason is dehydration is very serious condition in small babies, and this diarrhea is the main culprit behind the dehydration. The another reason is, if we see all the causes of mortality in children below the age of 5 years, this is one of the leading cause. Okay. Now we should know what is the definition of diarrhea. This is important because the newborns, the babies below the age of 1 month, they pass stool very often. In them, we cannot say increased frequency of stool is diarrhea. So in them, we use the definition if there is change in consistency. Mother comes to me that ma'am, my baby is 3 weeks old And earlier he used to pass stools okay. He used to pass 5 times, 6 times whenever I feed him, he passes stool. But that was okay consistency. But now for last 2 days he's passing very watery stool. So she is very sure of change in the consistency of stool of a 21 days old baby. So in that case, I am very clear that this 21 days old baby is suffering from diarrhea. It is not because of the number of stools per day, but it is because of the change in consistency of his stool. So that I am saying that he is having diarrhea. And one important thing which we saw in the case of Pankhi was that she was having loose motions for more than 2 weeks. So here I can repeat that she was suffering from persistent diarrhea. Okay. Now we go to the another slide. Uh, One very bad thing about UP is UP, MP and Bihar. They contribute to nearly 50% of deaths of all the children under the age of 5 years. And our medical college being in UP, it is very important that all the graduates which go out and serve the community after 5 years, they should be able to deal this condition. It is very simple to understand what predisposes a child to diarrhea, like poor sanitation, poor personal hygiene, not cutting your nails, not washing your hands, the water which we are using for making the milk, or the water which we are drinking or the child is drinking, or the food we are preparing is not completely hygienically prepared. I will not go into detail, but important thing to be mentioned is if a baby is breastfed for 6 months, he is safe. If bottle is not being given, he is safe. His immunization should be complete. Beside milk, he should be getting all the adequate solid and semi-solid food so that he is not malnourished. Okay? Now, one very important thing is what causes diarrhea. So viral diarrhea is more common than bacterial diarrhea. The importance of this slide is that most of the diarrhea do not need antibiotic. Okay. So the common causes other than viral are bacteria, protozoa and helminths. Among the bacteria, E. coli is very common. You will be studying about E. coli in your phase 2 MBBS microbiology. The other things are Vibrio cholera and Salmonella. Entamoeba histolytica and Giardia are also names which you must have heard in your second MBBS. I would emphasize that you should take a issue that diarrhea is not always infective. It can be because of non-infective causes, and this is very important. If we are using a syrup amoxicillin clavulanic acid to treat the otitis media in a baby and he develops diarrhea, maybe this is the use of this drug which is prone to cause diarrhea, and this is drug induced diarrhea. This is not infective diarrhea. Another very common thing is the iron tablets or iron syrups are being given to the children, adolescents and ladies. Some persons on oral iron, they may develop diarrhea. And there may be stress related conditions, like during your exams, you say that, madam, my stomach is loose, I have to use washroom repeatedly. And one very important thing I would like to highlight here is parenteral diarrhea. Parenteral diarrhea means there are some conditions in which the focus of infection is not in the GIT. It is not in the gastrointestinal tract. Maybe the baby is having otitis media, maybe he is having pneumonia, maybe he is having meningitis. But the parents bring him to us with the chief complaints of diarrhea. So that is known as parenteral. One thing is osmotic diarrhea. Many a times when we drink fruit juices, carbohydrate juices, baby may start passing loose motions. And that is again not because of diarrhea infection, but it is because of the non-infective causes. Pathogenesis, I will not like to go in detail, but one important thing I would like to say, the diarrhea can be secretory diarrhea, where activation of cyclic AMP is pushing out the fluid and sodium. Example could be rotavirus diarrhea and example could be cholera. In these conditions, antibiotic will not help because they are secretory diarrheas. Now we come to the assessment of dehydration, then there can be two things in the history which may guide me that this baby is dehydrated. One, we have seen decreased urinary output. The other we saw was irritability of the child. Is he irritable or is he lethargic? Then we have to examine the baby clinically. That means we have to see the baby. Four important things from head to toe we all must remember. We have to see the anterior fontanelle of the baby. We have to see the eyes, whether they are sunken or not. We have to see the skin pinch of the baby, and then we have to see the overall appearance of the baby. If he is lethargic, it means he is having severe dehydration like Tanya. If she is irritable like Paki, then it means maybe she is moderately dehydrated. So we categorize the dehydration into three categories. Is it mild dehydration? Is it moderate or severe dehydration? You have known the importance of duration of diarrhea from the previous slides. We have to ask and we have to ensure whether or not it is beyond 14 days. Number of stools are important to give us an idea of the fluid loss. Here I have mentioned the stool appearance and odor. Odor we mean to say if it is rice water appearance means like chawal ki madi and it smells like bad fish, rotten fish smell, maybe the baby is suffering from cholera. And if there is blood in this stool, we say the baby is having dysentery. Vomiting has been considered as a danger sign. The reason is very clear. Whatever the fluid or diet mother is giving, that is not being taken. So baby is losing the fluid but it's unable to take. So he is more prone for dehydration in comparison to a baby who has simple loose motion but no vomitings. Fever, if there is presence of fever, it means the baby is having some bacterial infection maybe. And if baby is losing fluid, he is also losing electrolytes. He is losing sodium, potassium, bicarbonate. So there may be sequelae of all these things. He may have convulsions and he may have distended abdomen, which is mostly because of the low potassium. The urine output is a very important history point which should be asked in all the children with diarrhea. We have to ask about the feeding history. We have to ask about the ORS, which was being given, how was it prepared. We have to ensure by history that the feeding practices followed are not faulty. We have to ensure that baby is adequately immunized. Now we go and examine the baby. I mentioned parental diarrhea. I am again emphasizing that a baby comes to us with diarrhea. We should not forget to see his ears for otitis media. We should examine his chest also. Maybe he is having pneumonia also. We have to ask the mother any history suggestive of urinary tract infection. And at the same time, we have to examine his CNS examination in total to assess whether or not he is suffering from meningitis also. This is a very simple slide. This is a repetition. I have already told you most of the things. The four important things from head to toe will be the appearance of the baby, anterior fontanelle whether sunken or not, eyes whether sunken or not, and skin pinch whether it is normal or it is bleeding. Now comes the importance of preparing ORS correctly. If a mother has prepared the ORS which is not very tasty fluid and baby does not want to take it, so mother is giving him plain water which baby is taking. So what the baby is losing in these stools is sodium rich fluid, but the fluid he is accepting is sodium free fluid. So such a baby is prone to become hyponatremia. The other condition can be mother is giving him ORS but she has wrongly prepared the ORS. In little amount of water she has added more of ORS salt. So such a baby on consuming such type of ORS are more prone for hypernatremia. That's why it is very important that we ask the mother how is she preparing the ORS. Lab tests usually we don't require. We simply treat the dehydration. We give zinc and baby becomes alright. But in some condition when there is blood in the stool or baby is having very high grade fever or baby is malnourished or baby has not passed urine for like 12 hours in case of Tanya, then we may need some investigations to make sure that his kidneys are working okay. He is not into the renal failure. And stool examination is important in case of Vibrio cholerae. You must have read or you will be seeing in your second MBBS that Vibrio cholerae on routine microscopic examination of stool by hanging drop preparation can be identified very easily. It has darting mobility and it is very easily to identify if it is present in the stool. And this is very important disease. If a baby's stool contains cholera, then we have to give him some drug to kill this bacteria, so that the sweeper, ayah, nurses and the staff who are handling the baby, they may not get this disease cholera. So we give doxycycline oral 1 dose to make the stool of this baby non-infectious. Again, I am repeating the same thing. We have to maintain the hydration. We have to regain the hydration. Zinc, I have told you the dose is different between the age of 2 months to 6 months. It is 10 mg. Above the age of 6 months to 5 years, it is 20 mg. And how many days it is to be given? The answer is 14 days. Antibiotics, very limited indications. Symptomatic, yes, if he is having abdominal distension, we have to take care of it. If he is having fever, we have to give paracetamol. Our treatment does not stop here. We have to ensure that baby gets correct feeding adequately. So this is the treatment plan. This is repetition again. One important slide has come. This is about ORS. What is the composition of ORS? We will wait few seconds on this slide. I would like you to check this ORS has positive ion sodium and potassium. Sodium is 75 millimoles and potassium is 20. If we add sodium and potassium, it becomes 95. Now we go to two negative ions. One is chloride and one is citrate. So chloride is 65 and citrate is 10. Citrate, one molecule in the body will go and liberate 3 molecules of bicarb. It means if I give 10 molecules of citrate, they will go in the body and they will make 30 molecules of citrate. So when I am adding negative ions, chloride is 65 and bicarbonate is 30. So again it becomes 95. It means the positive ions, sodium and potassium, are 95. The negative ions, the chloride and bicarbonate, are again 95. It is important to understand that the ORS is electrically neutral. And one very important thing is the osmolarity of ORS, which is being given by the glucose. So glucose is only 75 millimoles in liter of ORS. How does a baby who is passing such large stools, if we give ORS, he takes it and it goes into the intravascular volume and his sodium also become normal. This is by co-transport of sodium in the ORS with the presence of glucose. This is a very important aspect which we will be discussing when we will meet in clinics. For the time being, I am leaving this slide here. Now one very important thing, we are focusing only on ORS. But the important thing is, if a baby has diarrhea and in the beginning there is no dehydration, we should insist, because ORS is not tasty, it is costly, its preparation may be having some faults. So some home available fluids can be used, like curd, like khichdi, dal, banana, potato, no fruit juices and no carbonated drinks, but otherwise simple things he can take. When will ORS become ineffective and when we would like a baby not to be on ORS and in the hospital on IV fluids? This is very important, like in the case of Tanya. If a baby has persistent vomiting, Tanya had 5 vomitings in last 12 hours. She has become so lethargic, which was indicated of severe dehydration, as she has not passed urine for last 12 hours. So all these were conditions. Baby is not conscious, vomiting rate is very high, and she has not passed urine. Then we cannot wait for ORS to come and be effective. We have to be fast. She should not go into renal failure. So here is the reason where we will start IV. These are these formulas, these are the skills. You will be coming to us in the clinics. During your clinical posting skill hours, we will be discussing about it. Severe dehydration, nutritional management, I have told again and again. Drug therapy, I have discussed. Complications, yes, we have discussed. So prevention is important. I told you viral causes of diarrhea are commonest. Rotavirus is the main culprit and we are lucky to have a vaccine against this virus. Again, we have to not only prescribe the medicine, we have to ensure that mother has understood the hygiene, how to give feeds and how to give food to the baby, how to do hand washing. And if a baby suffers from diarrhea, we have to give him one prophylactic dose of vitamin A as well, which is very helpful. So I shall be thanking you here. Thank you very much, class. Bye.